It's important for people to learn first aid techniques because at the moment that's the missing link in the chain of survival, if you like. From our paramedic units arriving on scene to definitive care, that is now covered, but we need to have people trained in first aid. If they don't get themselves trained in first aid, or if they're unwilling to actually go on courses, then we can talk people through the first aid necessary to sustain life until the paramedic units arrive.
Have you an example or a case study of where someone who knew basic first aid techniques helped save a life?
Yes, there are many case studies where people have saved lives. Our trained operators are given instructions over the phone every day on every call. There's a number of patients who have suffered cardiac arrest and have been resuscitated. People can help, and they can help by learning first aid or listening to the instructions that the medical dispatchers will give them on the phone. It is important that they do the techniques, otherwise when our paramedic units arrive on scene, the chance of the patient's survival is limited.
What are the physical do's and don'ts of dialing 999 and asking for an ambulance?
Well, it's important for people to understand that they should dial 999 if they're in any doubt and they think they need to have an ambulance. Don't hesitate to dial 999. Our operators, our trained operators, our medical dispatchers will take the people through the calls, and if they listen to the information, listen to the questions they're being asked, and then they have the ambulance there straight away.
Over the next 5 nights on Channel 1, we will be showing you how you can help save lives by picking up some basic life-saving tips. This is Darren Charles for Channel 1, Liverpool.
Paul Brennan, Channel 1, FA Headquarters.
This week, Channel 1's teaming up with Mersey Regional Ambulance Service to give viewers the chance to learn the basics of first aid. Of course, such techniques save the lives of thousands of people every year. And in the first of our special reports, Darren Charles learns the ABC of life-saving.
Consider this. You find someone you know, a partner, a family member, a friend, or even someone you don't know in this situation. Would you know what to do? Obviously, the first thing to do is to dial 999 and ask for an ambulance. The Mersey Regional Ambulance Service has a policy of offering help over the phone. I've joined up, however, with Paul Gay from the Mersey Regional Ambulance Service Training School to find out what I and you can do to help save a life.
And what we've got to go through is what we like to call the A, B, C of resuscitation.
Just like the alphabet, easy to remember.
Easy to remember.
ABC.
ABC. Okay, first of all, A, airway.
Airway.
We've got to check the airway to see if there's anything in the airway. Then we go to B and we check to see if the patient's breathing.
Right.
And then we check C, which is circulation or the heart. And circulation is checking the pulse. All right? Now we link all those together by a simple procedure which we call mouth-to-mouth resuscitation, or CPR, cardiopulmonary resuscitation.
Cardiopulmonary resuscitation.
All right, CPR. Let's call it CPR.
CPR.
Keep it simple. Okay, here we go then. So we walk into the room and we always check for dangers. That's
Right.
very important.
So the immediate environment, shall we say?
Got to be no dangers, okay? We don't want to get down and start breathing into the patient. It may be just asleep.
Yeah.
So we gently shake the patient. Hello, can you hear me?
That's just to find out,
That's right.
you know, whether they're awake or not,
Great.
basically.
That's it. You wouldn't be the first one that's gone and he's woken up. It's a very embarrassing situation.
Yeah.
Don't stick your finger in a sleeping man's mouth.
Yeah.
Always remember that. All right. So we shake the patient. Hello, can you hear me? There is no response. So now we do the airway. We look, listen and feel for breathing. All right?
Look, listen and feel for breathing.
All right? We look at the rise and fall of the chest. We listen with our ear. We feel with our hand and our cheek if there's any breathing. There's no breathing in this patient. So what we've got to do now, Darren, is we've got to breathe for the patient. All right? So what we've got to do now is we've got to push air in there and down into the lungs. Simple procedure. We simply head tilt the patient and lift the chin.
Right.
All right? Anything underneath the patient, pillows, we lay them flat. We have nothing underneath them.
Right.
All right?
Clear underneath the neck as you tilt the neck.
That's right. And then pinch the nose. All right? Pinch the nose. Put our mouth over their mouth.
Yeah.
And 2 breaths.
2 breaths.
2 breaths. Okay?
Now, can they come around from that?
They could do, but it's not likely.
Right.
Okay? We then feel for a pulse. Now on an adult, we feel for a pulse in the groove of the neck, which is this groove here down the side, all right?
Right.
And you can feel for the pulse there. There's no pulse. So now we've got to look after the circulation.
Right.
Airway.
Yeah.
Breathing. We're now doing the circulation. Okay. Now then what we do now is again we bare the chest. Okay. Now you see this little Y here. This is important, this bit here. Everybody's got that, believe it or not. You've just got to be able to find it.
Right.
You run your fingers around the edge of the ribs at the bottom here, okay? And you'll find a little notch. Come up over the notch until you find the little end of the Y.
Right.
Put 2 fingers on there. Put this hand, the heel of this hand, down next to those 2 fingers like that.
Right.
All right? And then, locking your fingers together, you compress the chest about 1 inch to 1.5 inches.
Right.
Which is a long way, 15 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Once you've done that, you then put in another 2 breaths. Okay?
Yep.
Come back to that point, always check your hand, and do another 15 compressions. Right. And you do that 4 times.
4 times. 2 breaths, 15 compressions, 4 times.
4 times. You finish on 2 inflations. All right, 2 inflations. Then check the pulse again. Still no pulse. Carry on. Right. If you've got a pulse and the patient's breathing, you've scored. You've won.
And we continue in those cycles of 4
That's right.
until the paramedics arrive.
Till the paramedics arrive.
And it's as simple as that.
It's as simple as that.
The process you have just seen can help prolong someone's life until professional help arrives. So let's recap on the main points again.
Firstly, ensure that the patient is not in any immediate danger. Talk to the patient and gently shake them to check that they're not just sleeping. And remember the ABCs. A for airway, check the mouth for any blockages. B for breathing, look, listen and feel. And C for circulation, feel the neck for a pulse. If the patient isn't breathing, then administer 2 breaths. If there's no pulse, then follow with 15 compressions of the chest. Continue this cycle until either the patient recovers or the paramedics arrive.
Always remember that every single second is crucial, and just by learning the tips we've shown you today, you could help save someone's life. This is Darren Charles for Channel 1, Liverpool.
Stay with us here on Channel 1 for lots more news from across Merseyside coming up just after the break. Before that, though, let's see what's happening with the weather. Nothing can be perhaps more distressing than finding a child seriously ill or unconscious. In the second of our special first aid reports, Darren Charles reveals how basic techniques can make all the difference.
A young child, 1 minute happily playing, the next lying motionless on the floor. Could be your child, could be any child. Would you know what to do to help?
Well, check that they haven't swallowed anything, they have anything, you know, what kids are like, sticking stuff in their mouths.
Well, I check for the airways, see if anything's obstructing, and then I put them in the recovery position, and then ask, someone to call for an ambulance.
I haven't got a clue.
Obviously, the first thing to do is to dial 999 and ask for an ambulance. The Mersey Regional Ambulance Service has a policy of offering help over the phone. I went along to see Paul Gay of the ambulance service to find out exactly how we can help this young child. So Paul, we've already looked at CPR for adults, and now we're looking at it for children. What are the key differences in CPR for children?
Okay, the key differences are very simple and straightforward. We don't want to get too complicated.
Right.
If you remember, we did a ratio of 2 inflations to 15 compressions of the heart for the adults. On children, we drop it down to a simple level of 5 compressions of the heart to 1 inflation. So it's a simple 5 to 1 ratio.
5 to 1
5
ratio.
to 1 ratio, that's it, yeah.
Could you
Sure, why don't we show you and have a go?
Why not?
And then you'll be no problem
Right.
at all. Okay, first of all, we've got the little child here lying down.
Right.
Now again, we shake the child. Hello, can you hear me? There is nothing.
No response.
No response at all. So now we've got to find out if the child's breathing. All right. Again, nothing complicated. No special equipment. We use our hand, and we use the side of our face. All right. So we look, we listen, and we feel. All right. We look, listen, and feel for breathing. So that's the A. It's the airway out of the way. Okay. Once we do that, we then look in the mouth. You see, looking in the mouth. Nothing in there, is there?
No,
right. And we just gently head tilt back. We then quickly look, listen and feel again, because that action may have started the child breathing.
Right.
You with me so far?
So just that alone, tilting the head back, can help start the breathing.
That is all that may be needed.
Right.
A simple action like that. Right, the child is still not breathing.
No response.
Now then, if you look at the face, the nose and the mouth are very close together.
Right.
So we've got to get our lips,
Right.
or our laughing tackle, all the way around the
Right.
child's mouth and nose. All right, like so. And a gentle blow into the mouth
And
is
the
all we need.
chest.
The chest rises up, as you see. You watch it rise, okay? Then you feel for a pulse. Now then, on a child of this size, we can feel for the pulse in the neck. And the little Adam's apples in the middle, yeah?
Yeah.
And there's a groove running down the side here, which you can see, a little groove on the neck. And we can do this on ourselves. And we slip our fingers into that groove, and we feel for a pulse. For about 5 seconds. All right? And there's no pulse on this child. So now we have to pump the blood around for the patient. So what we do is we locate the patient's nipples, all right, the little child's nipples, and we put our hand in between the two nipples,
Right.
all right, just like so there. Now if it's a child about this size, you can use one hand, okay, and just do 5 compressions.
Are they gentle or heavy compressions?
They're gentle compression,
Right.
all right? Or if it was a smaller child, or even a baby, 2 fingers may be enough. 2 fingers is a simple compression.
So you make that decision based on the size of
Of
the
course
child?
you could.
Common
You make
sense.
that. Common sense is a big thing in this. And again, if you do 6 compressions and you do 2 inflations, it doesn't matter. But 5 to 1 is the best method. 5 little compressions and 1 inflation. And at the end of 4 times of doing that cycle,
Yes.
we check the pulse again. In the neck, here again, check the pulse. All right? If it's a tiny baby, all right, we would check the pulse in the position here. Let me just show you the arm.
Sure.
Now there's a pulse just under the arm here, all right?
And what age is for this?
This is for a little baby. A little baby, all right? And then we would put our fingers, excuse the pipes, a little fingers just there like that, and you have a pulse in the arm here.
Right.
So that's for little babies, because they've got short, stubby necks and you can't feel the pulse. All right?
I forgot one actually.
No, yeah, but don't worry about that, that's fine. All right? So it's in the neck for the larger children, under the arm for the smaller children. Simple as that.
And the breathing mechanisms into the mouth don't change?
Don't change, never change. And again, you keep doing this until the paramedics arrive.
And here are the main points again. Remember to learn them. It could help save a life.
Firstly, ensure that the patient is not in any immediate danger. Talk to the patient and gently shake them to check that they're not just asleep. And remember the ABCs. A is for airway, check the mouth for any blockages. B for breathing, look, listen and feel. And C for circulation, feel the neck for a pulse. If the patient isn't breathing, then administer 1 breath. If there's no pulse, then follow with 5 compressions of the chest. Continue this cycle until either the patient recovers or the paramedics arrive.
You're going to be okay?
It would appear so, sir. You've done a very good job. Well
Thank
done.
you. So as you can see, it's not that difficult to make a difference until the professionals arrive. This is Darren Charles for Channel 1, Liverpool.
Time now on Channel 1 to see what's happening with the weather. Third in our series of special first aid reports. Now, for many people, dealing with an incident where someone is obviously in distress can prove harrowing. But as Darren Charles reveals, simple techniques such as using a cold water tap can help save burn victims from lifelong scars.
Hello again, and thanks for joining us for another first aid tip. Now today I'm the unfortunate victim of an all too common accident, and that is a burn. Now would you know what to do in this situation?
Get a wet cloth, just get a wet cloth and throw it out on it.
Wrap the burn around with a wet cloth and then use appropriate creams there to cleanse the wound, definitely.
Cover with a damp cloth. Wrong.
Well, fortunately for me, I'm joined by Paul Gay from the Mersey Regional Ambulance Service, who's going to tell me what I can do. Paul, it's stinging hell.
How did you manage to do this, Darren?
Pouring hot water out of the kettle and it's gone onto the hand. But it's hurt. What can I do?
Okay, the first thing we've got to do, Darren, is make sure you're safe.
Right.
You've switched the kettle off, the kettle's out the way, that's fine. The second thing we've got to do is make sure there's an ambulance en route. Have you phoned for an ambulance?
Yes, someone's gone for the ambulance.
You've done very well so far. Now, you said it was stinging.
It's hurt.
Now, we've got the finest thing here on tap, so to speak, and that's water. Cold water, not hot, cold water. And all we do is turn the tap on gently, not too fast, just nice and gently. And then, if I may, but let's just, this is going to sting a bit, but it will cool it down and it'll eventually stop it hurting. There we go, that's good, lad. And we just gently run the water over it, all over it, so the cool water runs all over the burn. And you keep doing that until the ambulance arrives outside your door.
Right.
There you are. Does that feel better?
Yeah.
Good, let's just turn it on a little bit more there. There we are.
Right, that's great. Thanks very much indeed, Paul. I think I can hear your colleagues coming right now, so why don't we just take another look at the main points again.
Firstly, ensure that the patient is not in any immediate danger. Then cool the burn under cold running water. Keep cooling until the paramedics arrive. And in the meantime, remember to monitor the patient's airway, breathing and circulation.
Always remember that time is of the essence. Call the ambulance, follow the tips, and like me, you could be feeling better soon. This is Darren Charles for Channel 1, Liverpool.
With a dreary few days in store, let's take a look now at the full weather forecast. A seriously injured person can throw all their life-saving techniques out of the window. The stress of dealing with someone who's clearly in deep pain can make them forget the basics of first aid. In tonight's fourth report in our special series, Darren Charles explains how even the simplest of actions can save the paramedics vital seconds.
Continuing our series now of basic first aid tips on Channel 1. Now it obviously hasn't been my week because I've yet again got another injury. Now this time it's pretty serious on my hand, so the first thing to do and the most important is to dial 999 and ask for an ambulance. There will be help and information on the other end of the phone from the ambulance service. Fortunately for me, I'm joined by Paul Gay from the ambulance service who's going to give me some tips on what to do. Paul, it's hurting, what can I do?
Darren, first thing we've got to do is sit you down.
Sit me down.
Let's sit you down, so that you don't fall down. Okay? Right. Just sit yourself down there. You okay? Now just relax, mate. Just relax, all right? Now the first thing we're going to do is get you in the position. We're going to use a little anecdote here called peep.
Peep.
Peep. All right? Right. You got that in your head now?
Peep.
Peep, right. And the first P is position.
Position.
We've sat you down. Then we go to E.
E.
All right? And we're going to elevate.
Elevate.
All right? Elevate it. All right? Now once we've elevated it, we're going to have a good look at it and examine it. The second E. All right? Now we're going to pad and pressure. Any pad. I just happen to have with me a tea towel. Folded up neat and tidy. And that's better than anything. We'll just put it straight over the wound, like so. And then put pad and pressure. And the pressure may have to be quite firm until the paramedics arrive, and you'll be safe and sound.
Obviously, in this case, I am the victim, but it is possible to look after yourself on some occasions. So let's look at those main points once again.
For the control of bleeding, after ensuring the patient's immediate safety, remember the PEEP principle. Firstly, P for position. Sit or lie the patient down. E, elevate the limb. E again for exposure and examination of the injury. And finally P for pad and pressure to stem any blood loss. Keep the pressure on until paramedics arrive.
Well, as you can see, I'm now in the care of the professionals, but it's comforting to know that if what happened to me today was for real, I'd be in a better position to look after myself until the ambulance arrived. This is Darren Charles for Channel 1, Liverpool.
Well, join me again here on Channel 1 for lots more news coming up just after the break. But before that, let's take a look at the full weather forecast.
For tonight's fifth and final report in our special first aid series, we look at what to do in the event of discovering an unconscious person. More than any other situation, basic techniques including how to position the injured person can make all the difference. Darren Charles reveals all.
Hello again. Finally in our series of first aid tips on Channel 1, today we're going to look at what happens if you find a person who is unconscious. Now, as ever, the first thing to do is to dial 999 and ask for an ambulance. The Mersey Regional Ambulance Service has a policy of offering help over the phone. Fortunately, I'm joined by Paul Gay from the Mersey Regional Ambulance Service, who's going to tell me what I can do until the paramedics arrive. Paul, I was with my friend. He fainted, I caught him, and I've laid him down on the ground. What can I do, though, until the paramedics arrive?
Okay, Darren, well, you've done very well so far. You've caught the patient, you've put him on the floor in a nice position, comfortable for the patient. But there is a danger here. Because he's unconscious, he may accidentally, the tongue may fall to the back of the throat and he may stop breathing. There's one thing we can do right away that will alleviate that problem for the patient. It's quite simple manoeuvre. We put a hand under the chin, like so, and we just gently tilt the head back like so.
Right.
That simple manoeuvre there
Can help save a life.
can help save a life, because by that way the tongue comes off the back of the throat and the patient will have no problems, could start to breathe on its own. No problems at all.
Wow.
All right? That's one way we can save a life, okay? Now then, if the patient, because something was in his stomach, vomited, and he's in this position flat on his back, he could inhale the vomit. So we've got to turn him onto his side to stop the vomit being inhaled, all right? So let's take that step next, shall we? Okay. Let's just put the... There we go. Okay. Can I come where you are?
Yeah, sure.
Okay, let's change positions. Here we are. Now the first thing we've got to do is to just put this hand here, all right, under the patient like so, there, all right?
Right.
We'll take this hand just to protect his face when we turn him over, all right? Get the stones off his elbow there, all right? Now with this knee, we pull this knee up into that position there.
Right.
And protecting his head at all times. We don't want to bang his head, do we? We can turn the patient over into the recovery position. Supporting, that's it, supporting him there, and onto my knee. Making sure that hand is out, okay? That knee is in that position, and then we just ease back, and the patient is safe. If the patient vomits, all the vomit will pour out, there's no problems at all.
So really, have we been covering the airway, breathing, circulation?
You were listening yesterday. Well,
we've been covering the ABC of Lifesaving yet again for an unconscious victim.
That's right.
However, is this always the way to treat unconscious people?
Not always, Darren, because sometimes if a patient has fallen and got into a position on the back, they may be injured in other ways. And in that case, all we could do, if they weren't breathing, is to head tilt and leave them in that position until the paramedics arrive. Right. That's the secret of saving a life yet again, Darren.
So for the last time, let's look at the major points again.
If you encounter somebody that's unconscious, firstly, ensure that the patient is not in any immediate danger. Then perform a simple head tilt. If the patient has vomited, turn them into the recovery position. And keep monitoring the ABCs, that's airway, breathing and circulation, until paramedics arrive.
So there you have it. We hope that you've learned something today, and we've shown you that being of assistance is not as difficult as you might think. Always remember that whenever you telephone for an ambulance, the Mersey Regional Ambulance Service will be able to give you instructions to help save a life over the phone. This is Darren Charles for Channel 1, Liverpool.
Now for something a bit different. It's the first of Channel 1's travel specials, where roving reporters Jane Barrett and Amanda Goodman go off searching for Scousers around the world. We catch up with them in Ibiza, where 18 to 30s rule the waves.
Arthur. A traditional 1830 holiday welcome that is. You might laugh at the cheap plonk-swilling, would-be song-singing antics, but the 1830 mob is a force to be reckoned with out here. They're the biggest and one of the cheapest tour operators on the island. In terms of price, you can't beat them. So if it's a ticket out here you're looking for, you may as well join them. And don't be put off if you don't fall in the 20-something bracket. For this lot, it